Hi, welcome to the Watch and Whisper channel where I talk about things that are interesting to me. Well, for the last few videos, I've been talking about a show that I've been watching on the YouTube channel, and it's called Dr. Death. Very interesting. Again, if you don't know the premise of the show, it's about a neurosurgeon in Dallas that performs surgeries on patients, and he don't give a damn how the surgeries turn out. And it's about how the doctors that he's somewhat affiliated with, how they track what he's doing over an 8 episode series and the outcome. So we're on episode 3. I've already uploaded video um, 1 and episode 2. So if you want to find out what's happening in the first 2 episodes, please go and check out those 2 videos. Now we're going to talk about episode 3. Episode 3 starts in 2012. Remember, I told you earlier, if you don't like movies that bounce uh, future, present, past, this may not be the show for you. But however, everything ties together. You just have to keep watching it so that you can stay connected to the entire storyline. Well, in 2012, this particular episode starts where, excuse me, Dr. Kirby is talking to one of Dr. Dunt's former patients. He's already performed surgery on her. You can see she's in the hospital. She's not talking. And when he goes to talk to her, he's talking about the surgery that she had. He referenced that she had had some type of cervical repair. Well, he said, well, did you realize that when you were calling Dr. Duns after the surgery, he wasn't answering you? He answered once or twice, and then he just cut off all contact. Come to find out, he was supposed to remove a disc from her vertebrae, and he did not. He left the disc in. Not only that, he punctured her esophagus, and he sliced something else on her. I took some notes. He sliced her vocal cord, so the lady could not talk. So she was up. You could tell visibly. You could tell she was upset, and he pretty much told her, "There's a few things we can do to try to fix some of the damage that he caused. However, we cannot fix the sliced vocal cords." And basically, she wasn't going to be able to speak anymore. And he said that he had talked to her husband, and the husband had told her that their children were in town and wanted to come and see her in the hospital, but she did not want to see her children because she didn't want her children to see her that way. But I thought it was very selfish of Dr. Dunst to not reply back to the patient that had been calling him after he caused her the type of trauma, and now it's going to be lifelong trauma that he caused her. But Dr. Dunst was fired from that hospital. So I said, well, damn, that was real fucked up for him just to treat her that way. But that's how the episode 3 started off with Dr. Kirby talking to one of his patients, and they were at Legacy Medical Center. So the next scene cuts to Dr. Dunst was leaving a hospital and he was getting into a car. Now this is one scene that you have to really pay close attention to. He was getting into a very older model Ford Explorer. A young lady picked him up. The car was very dirty on the outside. Kind of looked like mine last week. But her car was very dirty on the outside. He picked her up and you can just feel the tension as soon as he got in the car with her. And she was pretty much talking and asking him, okay, what happened with the interview? And he said, well, they're going to hire me. I guess it's contingent on if he can come up with a actual patient roster. And so her face said that she didn't feel like he was going to be able to do it. So she referenced some of the other places he had worked and how he was not able to stay employed with those hospitals. And the tension with their conversation, you can feel it just from watching the TV, and you can just hear them kind of snapping back and forth at each other. And she pretty much told him, I don't believe in you. I don't support you. The only reason I'm helping you is because I don't want us to disappoint him. When she said him, the camera kind of switched to the back seat and you could see a small child. Right then let you know, okay, who is this woman? Because she just came out of the blue. She just picked him up from hospital. But when he called her name Wendy. So keep in mind Wendy, because Wendy is going to play a big part in this series, but you're going to find out more about Wendy a little later on. But he went to get out of the car and he asked her, okay, can I come by on Saturday? And she said, no, go sleep with your nurse again. And I said, okay, that's something right there. Because she said, go sleep with your nurse again and see how that works out for you. So he said that, and you could tell he was disappointed, hurt, or just defeated. And then again, remember, Dr. Dunst doesn't want anybody to tell him no. So they showed him step away from the car slightly and turn around. He passed her what appeared to be a check or a money order. And he said, it's from my dad. So she took it from him, and then the scene cut. And I was like, okay, so something's going on between those two. And obviously he don't have money because the dad is giving her money. And obviously that's his son in the back seat. But the story is going to progress later on. You're going to find out more about their dynamic. But that was a very pivotal scene in that episode 1. So the next scene, you see Dr. Scanton. I think that's how you pronounce his name. He and Dr. Dunce, he was introduced in this first scene. Well, really, it's the second scene. He was introduced, and Dr. Dunce was asking Dr. Stanton if he could apply for his fellowship. Dr. Stanton said, once you do all the things that are required, maybe you'll be accepted into the fellowship program. They cut to him walking up to an apartment, but there was a black lady walking away, and he stopped her and he was like, "Hey," I'm just calling her Trish because I don't remember her name. He's like, "Hey, Trish, where are you going?" And she turned around and cussed his ass out because basically she said that she was in his apartment and she found Oxy. She found a lot of prescriptions, and then he was like, "Oh, no, 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 no! Those prescriptions I've been writing for my friends." I'm like, "Well, damn, you telling her that you're doing something illegal because you're writing scripts for your friends and they not sick?" He goes into the apartment, and guess who's sitting in the apartment? Debbie, Jerry, the friend. So Jerry's in the apartment, and again, you can tell Jerry is like the polar opposite from Dr. Dunce. And you're like, what is it that keeps these two friends together? Because they just don't seem like they have anything in common. Um, they're sitting in an apartment and they're just talking and wrestling like they're 8 years old, all on the couch. But they start having a conversation because Chris starts to go into his computer and he's looking up something about I think it was stem cell research or something. And he starts talking to Chris. And he's telling Chris about his research and what he's going to be doing. And you could tell Chris was just intrigued. And at that point, Chris says, "Well, I want you to perform surgery on me." And he said, "My neck has been messed up since junior year football." So I don't know if he was referring back to in their college days when they met. But at that moment, you saw what Chris just has like blind faith in Dr. Dunce, which is his friend Chris. And I was like, wow, you just say, "Oh, I want you to perform surgery." But the look on Chris' face lets you know, okay, something is not going to go well with that particular situation with him possibly performing surgery on Jerry. But keep that in mind when Jerry said, "I want you to have surgery. I want you to perform surgery on my neck," because that was very, very interesting. But you also see where Dr. Dunce has started taking LSD. So he's just an old junkie and he's just out there doing what he wants to do on those patients. So that's just horrible. Let's see. I'm looking at some of my notes. The scene cuts to where Dr. Dunce is in an empty office. Again, the story bounces back and forth. So now you see Dr. Dunce in the office and you can see where there's some repairs on the wall, but it's empty. No patients, no employees, no cars in the parking lot, just a completely empty office, and he's the only one in there. However, he's unraveling in front of your eyes. He's searching all over this doctor's office, well, all over his office, looking for drugs, cocaine. He's looking at all of his hiding spots. So he's finding cocaine in different spots and he's just taking it. And you can tell that he's just losing it. He's trying to log into a computer, but he can't seem to remember the password. So he just flipping out. Every scene that they show him trying to get into the computer, he's getting more and more aggressive with the office furniture and how he's just walking around. So they're showing him at the computer, trying to get in, showing him flipping around the office, trying to look for his drugs, and he is completely flipping out. And you're like, damn, what is wrong with him? So he finds all of his hiding spots for his coke, and then that lets you know that back when him and Chris first started doing the coke, you can see how it's progressing, and he's just becoming more and more unhinged and out of control. So the next scene cuts to him and Dr. Stanton meeting with a group of physicians, I guess, or researchers from Russia, and they're with a company called Dysgenics. Remember, Dr. Dunce, he wants to find a way for disc to regenerate. Well, now he's talking to researchers from Dysgenics, and they're from Russia, and he's telling them all of the medical lingo that he needs to talk about to get them interested in possibly merging with him and using some of their research that they've already completed to merge with the research he's done, so that he can excuse me, so he can move forward with his plan to his stem cell research or something like that. The next scene cuts to Dr. Henderson and Dr. Kirby. They went to visit Dr. Stanton. So they talked to Dr. Stanton and just asked him about Dr. Dunce's time at that hospital, because by now Dr. Dunce is no longer there. Remember, it bounces back and forth, back and forth. So you have to kind of keep up. They go to talk to Dr. Stanton to ask him about the time when Dr. Dunce worked at his hospital. I think it was University Medical Center or something like that. Well, anyway, Dr. Scantton is just sitting there pretty much telling them, and they also brought x-rays. So they wanted Dr. Scantton to look at the x-rays of the patients that Dr. Dunce have already butchered. And so he's looking at it, excuse me, and he's saying, well, had he did this type of work while he was here with me, he would have been taken out of the fellowship program. He pretty much told them that what he did at his hospital, he didn't see anything wrong with it. And any of the mistakes that he made was when he was in Dallas. Now, Dr. Scantton was at, I think it was the University of Tennessee Medical Center. Remember, I told you in the beginning, Dr. Dunn bounced from state to state, from hospital to hospital, because he was butchering everybody everywhere he went. So he couldn't really stay in one place long. So Dr. Scantton pretty much told them, what y'all have is a Dallas problem, not a Tennessee problem. Because he's saying, hey, he's gone. Whatever he did was then. He's not here. I'm not worried about it. But it's going to come back up later on. Just remember, Dr. Scantton, it's going to come back up later on about the researchers from Russia and who has something to gain from that merger between Dr. Dunce and that Russian research company. So keep that in mind. Alrighty, so let me see, what else did we talk about? Dr. Dunce went back to his clinic. Remember, I told you there's nothing in there, no patients, no office staff, nobody. Well, he started just flipping out again and just started calling all these patients, just cold calling patients, former patients, pretty much trying to get patients to come in. Because remember, he told Wendy in that car that hospital said that they would hire him if he could come with a verified patient list, a patient roster. Well, at this time, he didn't have any because he was killing everybody. Well, he was doing all these cold calls, trying to catch these patients on the phone, pretty much just trying to call them to see if they were still sick and if they wanted to possibly come back and see him. He even went so far as to tell somebody, oh, your consultations will be free. Some of the patients were halfway interested. For the most part, he kept scratching everybody's name off. They weren't interested. Well, he was real disheveled too. Oh, he looked a hot mess because this is when he was going on his coke binge and flipping out in his office all by himself. Well, at this point, I guess he said, well, hell, fuck it, I'm supposed to just go ahead and leave. He used to get ready to go outside, shirt all messed up, and he noticed there's a car pulling in the parking lot. And he was like, oh, no. He made a beeline to run back into that office. Tried to put himself together and put a doctor jacket on. He met a patient at the door, and he was such in a haste to get back in the office, he left the keys in the outside of the door. So the patient was like, hey, your keys were in the door. He told the patient went to see Dr. Dunce just based on the video he saw. That's how he chose his neurosurgeon. He had been in a motorcycle accident 6 years prior and had multiple surgeries, and his neck was still messed up. So he was just like, let me just throw something in the wind and see what stick to the wall. And he just saw a video with Dr. Dunce, and he decided to go to Dr. Dunce so Dr. Dunce could perform surgery on him. Well, they sat in the office and talked a little bit. And Dr. Dunce, what he does with all these patients, he just give you this rose-colored picture telling you how great the surgery is going to be and what your outcome is going to be. Rarely happens, but that's what he did. Well, anyway, he was talking to this patient, and he pretty much told him that he could fix what was wrong with his neck. Excuse me. At that point, the scene cuts to Jerry and Dr. Dunce in a strip club. Remember, I tell you, the dynamic is just totally opposite. Well, they go to a strip club, and you see Jerry is sitting in there with Dr. Dunce. And at this time, Dr. Dunce say, hey, I'm going to be moving to, I don't remember the state, but he told Jerry, hey, I'm moving. You need to come with me. And Jerry was like, well, what am I going to do? He was like, well, you live with me already. You drive me everywhere I want to go. So come on, I'm just going to say Nashville. I'm going to Nashville, and you can come with me. So Jerry was like, you know what? You're my best friend. Wherever you go, I'll come and work for you. Whatever you need me to do. Pretty much like his right-hand man, his yes man, gopher, whatever you want to call him. That's what Jerry was. Well, it was at this moment where they went in the strip club, just having some drinks and just basic chit-chat, talking about the move. And he cuts his eye, and he sees this lady dancing on the side, and she was doing a lap dance for some other gentleman that was in there. So he kept looking, and the lady would look at him, he would look at her. She would look at him, he would look at her. So okay, it's getting ready to be something. He gets up to go talk to the stripper, because that's what she was. She was a stripper, or should I say an exotic dancer, whatever you want to call them nowadays. And, they just had a little banter back and forth. And the episode ends when she says her name is Wendy. I'm like, okay, there it is. That's the Wendy who was in that car who picked him up, who ended up with a baby. So keep all that in mind because remember, it bounced back and forth. So now I let you know that by the time we go into episode 4, it's going to show more about him, Wendy, and possibly moving to another city because he was just talking to Jerry about moving to another city. So make sure you come back and check me out on Watch and Whisper to see what's going on with Dr. Death on episode 4. Hope you liked what you saw. If you did, please drop down in the comments and let me know if you're watching Dr. Death on the Peacock channel. I find it very, very, very interesting. And if you're not, consider giving it a chance. If you are, tell me in the comments what you think about it. Alrighty, until next time, and I'll come back on episode 4. Talk to you later. Bye, London. Bye, Bam.